goal for the endocrine fellowship program is to train outstanding clinical endocrinologists who can practice in an academic environment or in private practice.
Really, the interview day really sold me. The program director was so inviting. Literally, one of my questions to her was, is there anything that this program doesn't have, or that any opportunity or exposure that we don't get? And she's like, literally in this program, you will get everything you need to become a great clinical endocrinologist.
Faculty play a critical role in the training program. They are integral to creating a learning environment that's collegial and stimulates learning.
I went on a ton of interviews. A lot of these interviews after a couple weeks start to blend together, but for whatever reason, Brown University kind of stood out a lot to me. And I think a lot of it had to do with kind of what were my interests in a fellowship program, what I kind of wanted out of it. My whole goal was to become a clinically sound endocrinologist, and I thought that Brown University had a very strong focus on that aspect of training.
We work very closely with the fellows, not only in the inpatient but also in the outpatient setting. What is unique is that the fellows have always access, and I think I myself was blessed with great mentorship during my fellowship, and I think these relationships are important to shape their careers and paths as well as future endocrinologists.
The program here is very strong in diversity of patients, and I think that comes from being in different clinical sites. So not just here at Brown, but also at our clinic at Chapman, and then we also do a clinic at the VA. And so you get a lot of different patients that present with different comorbidities, and I think that's really good for for training purposes.
One of the nice things about our program is our teachers come from a variety of backgrounds, our faculty. So there's a differing perspectives each time that the fellow rotates with us. And that's important because there's no one way to actually skin the cat. And there's always some different way of dealing with a problem. And that exposure in all these various settings is an important part of the training for the 2 years that they're here.
One of the strengths of the program is essentially to train our fellows to not only be good clinicians, but also outstanding educators. Whether our fellows are in a private practice setting where they're caring for patients, education is a critical component because they have to teach their patients and their staff and their referring providers. And those that end up in academic environments, their goals are to teach, trainees in medical school, residency, and fellowship education, and with an aspiration of essentially being leaders of those educational programs in the various institutions that they may go off and participate in.
During the 2 years of training, fellows for sure have lots of opportunities to work either on a case report, a book chapter, research projects, and quality improvement projects, because I think once you get a handle of that when you're out in the real world, it's important to kind of use that as like a base handle for managing patients.
There are many opportunities for education for the fellows beyond the division. They, in addition to doing their rotations within endocrinology, they rotate with genetics, they rotate with the bariatric surgeons, the endocrine surgeons, reproductive endocrinology, and more. And so we have, beyond our faculty within endocrinology, we have a lot of other divisions with faculty who are very committed to educating our fellows.
This program really lends to a lot of different sorts of disease states within endocrinology. Not only do you see a lot of diabetes, but within the inpatient settings at Providence VA, Rhode Island Hospital, and women and infants on occasion, you'll see a lot of different sorts of disease processes that fellows will be exposed to. They'll become more comfortable treating. They'll also kind of learn where to go in terms of resources and experts on how to answer certain questions.
I couldn't possibly picture having a better relationship with my colleagues. I think everybody is really, if one person has a little too much work, everyone else is always willing to give a little bit more to help them out.
In terms of location, this area is absolutely wonderful. Providence has so much to offer in in addition to just both academics in this area, there's so much to do, whether you're interested in water-related activities or going to the beach or any of those types of things. Like, I feel like the city has something for everybody.
There's lots of places to eat, all on Thayer, Federal Hill. There's beaches, there's lots of hiking areas too, there's some state parks. So it's a very friendly area in general. People are very welcoming.
This was an extremely inviting and friendly atmosphere, and I've really enjoyed my time here so far.
Brown is the perfect place to learn endocrinology while also growing as a person and as a human being.
The strength of the program is essentially to train outstanding clinical endocrinologists, but also people who can be educators in these various settings.